As cases are rising, several states are actually scaling back their reporting of COVID-19 statistics, including Florida, Nebraska, Iowa, and South Dakota. And joining me now to talk about that is Dr. Thomas Duszynski. He is an epidemiologist at the Richard M. Fairbanks School of Public Health at IUPUI. So these states actually started scaling back their reporting just as these cases across the country started to skyrocket. Doesn't that deprive the public of real-time information on outbreaks and hospitalizations and deaths in their communities? Florida, for example, has said it makes sense given the decreasing number of cases and the increasing number of people being vaccinated. Does that make sense to you?
No, I would really have to question why they're doing this, right? I mean, there are reasons why to do this. One of the reasons that I could think of would be the loss of capacity, right? We've seen over the course of this pandemic that a lot of good people from the public health field have left or resigned or been asked to leave for various reasons. And if they've lost capacity, right, we need to also then look at public health funding. Do we have funding to replace these important positions, right, so that we can report every day? I think those are really important questions to ask, why they're doing this.
And you touched on this a little bit, but why is it important for the public to know these numbers in real time? How do these statistics actually translate into public health measures?
Absolutely. I think there are three features that we have to think about for these public health measures. One, I have to worry about what we call exponential growth, right, where we're seeing this doubling of cases, sometimes daily. The second feature is disease progression. In terms of we have various stages of disease, pre-symptomatic, symptomatic, maybe hospitalization, and in some serious cases, an unfortunate outcome such as death. And then the third thing that we have to be concerned about is the variants. We've all heard about the Delta variant, and it's rapidly becoming the most common strain here in the U.S. But now there's another strain out there called the Lambda variant that we're worried about. And those variants can seriously affect the daily reporting of numbers. So I think it would really be helpful, definitely for like hospitals, to know which way are we trending. I don't want to wait a week to see which direction we're going and then have to wait another week to see if we've made a difference one way or the other. So if we see an increased number of cases in the population, then we can expect hospitals to start seeing an increased number of people being admitted to the hospitals, which helps them prepare for maybe what's coming.
And the states are still sharing these numbers with the CDC, correct?
Yes, right now I believe it's still nationally reportable, so that states and territories are required to report those cases to CDC. Now, there are certain requirements as to when they have to report those, and that's just based on the ability to move data from A to B, really.
So how much of this is actually political, right, when it comes to COVID? Because there is a long history of reporting other infectious diseases like the West Nile and the flu.
Yeah, and that's why I want to know why they're doing this, right? I mean, that's really, if it's for a political reason, then that to me doesn't make any sense, because if we're just trying to downplay the existence of this virus, we all want to keep the economy opening, we all want to have people working, we all want our kids back in school, but I don't want to disguise that and just say, oh, don't worry about the numbers, right? It's more about tell us what's really going on and we can make decisions.
So what's the solution here? I mean, is there any leverage anyone has over the states to release numbers more frequently?
No, well, so every state is its own jurisdiction, right? So CDC isn't over the states. So, basically, states have their own jurisdiction. So Indiana can choose to do what they want to do. Nebraska could choose what they want to do and however they want to do it. So it's all contained within the state itself.
All right, Dr. Duszynski, we really appreciate having you. Thank you so much for your time tonight.
You're very welcome.